Hello, and welcome to Focus Med's Facts with Dr. Christy. I'm Dr. Christy Gleaton, your host and your pharmacist that cares and empowers. I am excited about the positive reception to our broadcast and encourage you to send us your healthcare questions via email to info@focusmedspharmacy.com. Again, that's info@focusmedspharmacy.com. Your question may be the subject of our next podcast. If it's not answered directly on the podcast, we will definitely respond to you via phone or email. So today's question is a hot topic in the pharmacy community, and I'm ready to provide you with answers that will help you to make informed decisions for your personal health. Today's question is, what are the new weight loss shots? Are they effective and are they safe? Oh boy, so let's dig right into it. We've all seen or heard about these shots, from celebrities to politicians to our neighbors. It seems that everyone is using them. The medications that I am specifically referring to are GLP-1 agonists and GIP agonists, such as semaglutide and tirzepatide, the active ingredients found in either Ozempic, Wegovy, Zepbound, or Mounjaro. These medications are currently being used in an injectable or oral form, such as pills, lozenges, or films for weight loss. These drugs fall into a drug class known as GLP-1 agonist or GLP/GIP agonists. They were originally approved by the FDA for the treatment of type 2 diabetes, but have been recently approved for the treatment of obesity. These drugs work by mimicking the action of certain hormones in the body, namely GLP-1 or glucagon-like peptide. Normally, when you eat, GLP-1 stimulates the body to produce insulin. Insulin encourages the movement of sugar out of the bloodstream and into your cells for energy. This is why GLP-1 drugs are effective at lowering blood sugar and treating diabetes. At the same time, these medications slow down the movement of food from the stomach to the small intestine, a process we call gastric emptying. This delay in the emptying of your stomach makes you feel full faster and longer, so you eat less. These medications have also been shown to increase what is known as your basal metabolic rate, which simply means the number of calories that your body burns when you're at rest. So in a nutshell, these medications help to cut your appetite, help you to resist the urge to overeat, and help you to burn more calories with less activity. Studies have also shown that these drugs enhance the body's ability to break down stored fat, further contributing to weight loss. These medications have also been shown to have cardiovascular benefits, often leading to a reduction in systolic blood pressure and reducing the risk of stroke or heart attack by 20% in adults with heart disease or obesity. So now that you know how they work, we have to answer the question of, do they really work? Well, the short answer is yes. However, we at Focus Med's Pharmacy emphasize the importance of lifestyle modifications, including a balanced diet and regular physical activity. These elements combined create a union that maximizes your chances of long-term success. So let's take a moment to discuss the safety profile and side effects of these medications. Because these medications slow gastric emptying, they may cause mild to moderate cases of nausea, vomiting, or diarrhea. These side effects are mostly dose-dependent and decrease with ongoing treatment. At our pharmacy, we recommend starting with the lowest effective dose and titrating upward gradually. In addition, GLP-1s have been associated with pancreatitis or inflammation of the pancreas. While this risk is relatively low, you should be aware of the symptoms of pancreatitis, including severe abdominal pain and severe vomiting. If you experience either of these symptoms, you should seek medical help immediately. In persons with type 2 diabetes, these medications may increase the risk of hypoglycemia or low blood sugar. Finally, there have been reports of thyroid tumors in rats that were given semaglutide during clinical trials. Although it is not clear whether these medications have the same effects in humans, we strongly discourage the use of these medications in persons with a personal or family history of medullary thyroid carcinoma or a condition known as MENS, multiple endocrine neoplasia, a disease characterized by overactive endocrine glands and the formation of tumors. Persons who have type 1 diabetes or take insulin should also not use these products, as they can increase the odds of low blood sugar. So who would be a good candidate for these drugs? Number one would be persons with poorly controlled type 2 diabetes that are having difficulty reaching their target blood sugar levels over several months and have complications such as heart failure or chronic kidney disease. The second best candidate would be a healthy person who has no history of thyroid cancer with a body mass index of 30 or above. I do not recommend GLP-1 receptor agonists for persons who are pregnant, allergic to any component of GLP-1 drugs, persons living with severe gastrointestinal conditions such as inflammatory bowel disease, and those that are at an increased risk of certain types of thyroid cancer. So which GLP-1 drug is best? A recent 2024 systematic review and meta-analysis found that tirzepatide, a combination GLP-1 and GIP agonist, was most effective at controlling blood sugar. Review data from 2021 supports semaglutide as the most effective GLP-1 drug for weight loss. So how quickly do these drugs work? This depends on the formulation. Some forms are fast-acting and used daily, while others are long-acting, like injections, and can take weeks to reach a therapeutic dose in the body. Lastly, how long-lasting are the results of these medications? If you stop taking GLP-1 receptor agonists, rebound effects are possible. As your body adjusts to the lack of GLP-1 activity, you may notice the return of hunger, weight gain, and elevated blood sugar. In clinical trials for semaglutide, 1 year after stopping the medication, participants regained up to 2/3 of the weight that they lost. We recommend using these medications to jumpstart your weight loss while adjusting to healthier eating habits and increased physical activity. Talk to your doctor or pharmacist to determine if these medications are right for you. At Focus Meds, we offer a comprehensive weight management program that incorporates GLP-1 medications into a total lifestyle change that is centered on holistically modifying your health and naturally stimulating GLP-1. Contact us today for more information. That's it for now. As always, be enlightened, emboldened, and empowered when managing your health. Until next time.